Welcome, focused learners, to this GCSE Revision Explainer. Today, we're basically going to act as the mind's mechanic. You know, when your car engine starts making a weird clanking noise, you take it straight to a garage to figure out what's misfiring. Well, today, we're looking at how psychologists figure out what's misfiring in the human mind, specifically when it comes to depression, and more importantly, how they use cognitive treatments to fix those faulty mental engines.
But before we start the actual review, let's do a quick mental warm-up. What can you recall right now about Beck and Ellis? Take a second, dig deep into those memory banks. Activating your prior knowledge right at the start is going to make the rest of this explainer so much more effective. Got a few ideas bouncing around in there? Awesome.
So, here is our revision blueprint for today. We're going to cover depression's cognitive roots, the CBT umbrella, models from Ellis and Beck, look inside an actual CBT session, and finally, evaluate the therapy.
Let's jump into Section 1, Cognitive Roots, explaining depression.
Okay, so the absolutely crucial takeaway here is that the cognitive explanation does not look at biology or genetics at all. Instead, it argues that depression is caused and maintained by faulty internal thought processes. Essentially, what happens is the patient develops negative schemas. These are deeply held mental frameworks, and those create negative biases. These biases totally distort how a person interprets themselves, how they view the world around them, and even how they predict their own future. So how do we actually fix these thoughts? That brings us to Section 2, CBT umbrella treatment, changing how we think. This is the primary garage where both Beck and Ellis do their mechanical work. That garage is CBT, or Cognitive Behavioral Therapy. In plain terms, this is a treatment for depression that fundamentally aims to change the way a patient thinks. Now, while it most commonly involves one-on-one sessions with a therapist, sitting down and hashing out thought processes, it's actually highly adaptable. Patients can do group CBT, they can log on for online sessions, and it can even be used alongside biological drug therapies.
Now, the core philosophy of CBT is built on this continuous cycle. The therapy rests on the foundational idea that our thoughts affect our feelings, which in turn affect our behaviors, and then that cycles right back around to influence our thoughts again. It's an endless loop. But if you can intervene and change those faulty thoughts at the very top of that cycle, you can positively alter the feelings and behaviors that follow.
What's really fascinating here is how our two master mechanics, Aaron Beck and Albert Ellis, differ in their approach. Both of their therapies sit comfortably under the CBT umbrella because they both aim to change maladaptive thoughts to reduce depression. But they approach the fix slightly differently. Beck focuses heavily on dismantling what he calls the negative triad, whereas Ellis focuses on challenging irrational beliefs through his ABC model.
Let's look at how they actually do this, starting with Section 3, Ellis's ABC model and REBT, challenging beliefs. So Ellis designed the ABC model to show exactly how irrational thoughts trigger depressive symptoms. Let's walk step by step through a classic example. First, we have A for an activating event, like say, someone loses their job. This immediately triggers B, a belief. In a depressed person, this belief is wildly irrational. They might think, I'm entirely useless and I'm never going to succeed. Naturally, this leads straight to C, the consequence, which is feeling incredibly negative, hopeless, and depressed about the future.
But look at how Ellis's rational emotive behavioral therapy, or REBT for short, completely flips the script. The activating event stays exactly the same. They lost the job. But now the therapist steps in and helps the client identify and challenge that irrational belief, replacing it with a rational one. Something like, you know what, I didn't even like that job anyway, I'm going to go find a better one. Suddenly the consequence totally changes. The client feels positive and motivated. Changing that one belief literally changes everything.
All right, shifting gears now to Section 4, Beck's cognitive therapy and the negative triad.
Beck developed his therapy specifically to challenge that negative triad. And it's a very structured process. First, the therapist assesses the severity of the depression, just to establish a clear baseline so they can monitor improvement. Then, the client shares how they perceive themselves, the world, and their future. Now, the absolute key here is something called reality testing. If a client sits there and says, I'm totally useless and I always fail, the therapist will directly challenge this. They'll ask for actual proof. They might say, hold on, have you literally ever been successful at anything? The client is then actually assigned homework to go out and demonstrate their ability to succeed in the real world.
Let's move to Section 5, Inside a CBT Session, Mapping the Treatment Program.
We know the theories, but what does a standard repair session actually look like for the patient from start to finish? Well, a complete treatment program always starts with an initial assessment. That branches out into formulating a plan and setting really specific goals. From there, you enter the active treatment phase. This is essentially a constant working loop of in-session therapy, assigned homework, and monitoring progress. And this loop just keeps turning until the goals are met and the treatment is officially complete. Just to give you the highly specific logistical details for your notes, a standard course of CBT usually takes somewhere between 5 and 20 sessions. These happen weekly or fortnightly, and they last between 30 and 60 minutes each. And in reality, most therapists actually pull techniques from both Beck and Ellis. Oh, and a massive part of this phase involves homework tasks. Things like keeping thought diaries, where patients have to track their irrational thoughts outside of their sessions and actively practice the coping strategies they discussed with their therapist. The whole point of these sessions is direct confrontation. In CBT, the client's beliefs aren't just listened to, they are challenged. By making clients acutely aware of their own negative views, they can begin to literally tear up those rational beliefs. Throughout this structured process, those impossible, maladaptive ideas are successfully replaced with much more optimistic and balanced ones.
Finally, we reach Section 6, Evaluating CBT, looking at strengths and weaknesses.
It's time to read the customer reviews for CBT, because weighing these strengths and weaknesses is exactly what secures those top exam marks. Let's start with the immense strengths. Unlike biological treatments, like antidepressants that often just mask the symptoms, CBT actually tackles the current thinking patterns that are actively maintaining the depression. Because of this, it teaches the client lifelong skills that they can carry with them and use in future situations. And crucially, it is heavily supported by research. For your exams, you'll definitely want to remember the Young 2007 study. It's an excellent piece of evidence proving CBT's high success rate.
However, it's not perfect. There are some notable weaknesses here. Some clients can become overly dependent on their therapist. Plus, CBT is largely ineffective for people who hold incredibly rigid attitudes or who strongly resist change. But the biggest hurdle, for sure, is motivation. Think of a CBT therapist kind of like a personal trainer. They can advise you, push you, and encourage you, but they cannot lift the weights for you. Because severe depression actively drains a person's motivation, some clients simply cannot do the heavy mental lifting required. It is a lot of hard work, and it's certainly not a quick fix.
And that brings us to the end of our cognitive toolkit. But I want to leave you with a powerful question to keep your mind working. Based on everything we've unpacked today, which do you think is the best treatment for depression, biological or cognitive, and why? Weigh the quick fix of medication against the hard work but lifelong skills of CBT. Think about it, structure your argument, and keep learning. Thank you so much for joining this explainer, Focused Learners. I'll see you next time.